And here with your answers to your medical questions is our Ask the Doc segment, and Dr. Levine joins us. Thank you so much for joining us.
Thank you. Appreciate it.
Absolutely. So let's talk about these concussions and what students kind of need to be wary of, because when something like this happens, a lot of times they brush it off.
Well, a lot of times they have protocols that they have in place now, especially the team sports like high school, cheerleading. So it's really out of their hands. A lot of times they're told what to do, and they can't go back until they're cleared by a trained physician. Certainly concussions have become a big issue recently. I played high school football here, played college football. We weren't talking about it at that time, so it's nice to know there's a lot of information out there. We're protecting the kids because it's all about their future. We don't want any type of issues to occur. We certainly want people to be active and enjoy life, but you have to be careful. And so a lot of times it's out of their hands. It's a protocol. They just follow it. You can't really break the protocol because it's such a serious situation.
And it's very important that protocol is in place as well.
Oh, absolutely. And it's glad to know that people are taking to it. It took a little while for it to gain some steam and gain some traction, but it has gained a lot of traction now. So we're happy to know that, and that people are happy about it. They're not aggravated with it, and understand it's a good thing for the community.
All right. Well, let's go to Facebook and try to answer some of these medical questions.
Absolutely.
And a female says, if someone has a kidney stone, what is your best advice to them?
To try and figure out what type of kidney stone it is. That way we can kind of backtrack and figure out what to do to prevent further kidney stones. I think if you don't know what kidney stone it is, which a lot of times we don't find out, hydration is really the most important thing, and certainly getting some basic blood work to see if there's anything metabolically going on, because a lot of times that's what causes kidney stone, is a metabolic abnormality. Looking at the consistency and the chemistry of the stone allows a doctor to determine what abnormality it is and then recommend certain things in their lifestyle.
Yeah, what are some ways to get rid of them?
Really, the only way to get rid of them a lot of times is just to urinate, certainly if it's small. If it's large, then the urologists have to use instruments and stents to extract the stones. There's a procedure called lithotripsy where they use a shock wave to break the stones up, so a lot of different ways.
And what if someone's been diagnosed with kidney failure? Are there some ways to work through that before you have to think dialysis?
Yeah, absolutely. Kidney stones don't necessarily cause kidney failure, although they can, especially if they're blocking the kidney or they're causing severe infection. So kidney failure is a whole nother story.
Yeah.
For most patients, it's related to dehydration, medications, sometimes blockage from prostate. So two different types of situations. But you're right, sometimes kidney failure is reversible and they don't have to go on dialysis. But a lot of patients, unfortunately, do end up on dialysis.
What are some of the treatments, possibly?
Really just trying to find the cause of the kidney failure. A lot of times dehydration, medication. So we would rehydrate the patient. We would stop the medication. If they have a blockage of their kidney, we would treat the blockage. Again, sometimes it's too late and they have to go on dialysis.
Okay. Can wisdom teeth removal cause a sinus or an ear infection?
Typically not. I mean, I think those are unrelated. They're kind of close together, but I'm not used to thinking of a sinus infection after tooth being extracted. But I don't think one causes the other, but it could be coincidental.
Okay. A friend of mine said she blacked out about 3 times and has a headache. She couldn't go to work this morning because of this, and she never misses. My question is, what can cause the blackouts? Is it because of her headache?
The medical term is called syncope. When someone passes out, I think a lot of times those are two unrelated issues. I don't think the headache can cause it unless it's severe. I would certainly get to the emergency department for a full evaluation of the electrical system of the heart.
All right. Well, Dr. Levine, thank you so much. And, of course, we're going to continue this conversation right after the break. We'll answer more questions for Live at 5. We'll be right back. Well, we're back to answer your questions, your medical questions. And, of course, one of the callers that called in wants to know about how to prevent athlete's foot.
That's basically a fungal infection. A lot of times you just have to kind of rotate your shoes. I know a lot of people wear the same shoes all the time, the same flip-flops, the same shoes when they cut the grass. Basically what happens is it starts to harbor fungus in the shoe, and it basically gets in our skin layer and sets up shop. Normally if it's flaky, itchy sometimes. A lot of people just think it's dry skin. They just put a lot of lotion on top of it, but it's fungus. I would try the over-the-counter products first of all, but again, rotate your shoes. Don't wear the same shoe every single day. You have to let it air out, otherwise it'll build up.
All right, well, let's go back to our Facebook questions. It says, my husband complains of headaches daily. He suffers from allergies as well. Could the two be related?
That's possible. You know, the more common causes of headache are migraine, stress headache, and headache from the neck. But a lot of people have facial symptoms, facial tightness, and they think it's allergies. And a lot of times it's not. It's related to those headaches. So they kind of could be related. Allergies more give symptoms of sneezing, watery eyes, congestion. That's more of an allergy problem. So if you're not having those symptoms, but you have facial pressure and headache, it might be a migraine. A lot of times you just have to try the medications and see which one works the best.
Okay, my primary caregiver prescribed, and I'm not even sure that
levothyroxine.
Okay, 25 milligrams for underactive thyroid. I'm 60 and overweight compared to 8 years ago. Now, I don't remember him ever doing an exam for thyroids or examining me to what he was doing one. I am overweight, and I said tired all the time, no energy, don't have any determination to get up and clean house. A few minutes of work or standing for any length of time exhausts me. Can you explain what an exam for thyroids consists of, and is that part of your field of expertise?
For most general exams, we can palpate the thyroid here in right underneath the chin, the neck area. It has to be actually fairly large to feel it, or have a very large nodule to feel it. We can do an ultrasound if we are concerned, but for most people, it's a lab test that we do for most people. You don't have to complain about anything. I include that on my general exam as well for most patients. And so probably they did some labs, saw that it was abnormal, and put on some thyroid medication. Now she should go back and by 4 or 6 weeks recheck her thyroid, because it might need adjusting. So if she's not had that, then I would certainly recommend that.
And of course, with those problems could possibly be why she is overweight, right? Those are all
absolutely
things that go hand in
fatigue,
hand.
weight gain, constipation, just mental fogginess, dry skin. All of those are symptoms of thyroid. Absolutely.
All right. Is it okay to lie about how much alcohol I drink at doctor visits, or why ask a question like that anyway?
It's just part of the history. I mean, alcoholism can cause a lot of medical problems. So when patients come to the office, we're there to talk about their health, and alcohol use and abuse is extremely common in our population now. When I was growing up, it was still a little taboo. But now everyone is drinking. It can cause so many problems. So we want to know about it as a doctor. So I can understand the reluctance to not talk about it, but we just need to know. We're just trying to help the patients figure out what to do with them. So try not to lie. Just be honest.
Okay. If I had whooping cough a month or so ago, am I immune to it, or do I need a shot?
You should be immune to it because your body responds to the bacteria that causes whooping cough. Certainly immunizations never hurt. Even with the virus that causes shingles, we still recommend they get immunized even though they've had an outbreak. So I still would get the immunization.
All right, I think we have time for one more question. My baby has eczema. He's only 8 months old. I have tried using many different types of hydrating lotions, but it's not gone anywhere completely. What do you recommend? Probably
some topical steroids, and certainly a referral maybe to a dermatologist to exclude other illnesses.
All right. Well, Dr. Levine, as always, thank you so much for your expertise. We appreciate it. We will see you next Monday. And a reminder, you can always visit our website and see the answer to the other medical questions posted online. And if you want to have Dr. Levine answer your medical questions, you can always mail us at the address listed on your screen. You can email us at laf@kfdm.com, or you can send those questions in every Monday right here on Live at 5.